So the most common cause of sciatica is a slip disc or prolapse disc, also known as herniated disc. These terms are interchangeable, and essentially that means there's pressure on a nerve that forms the sciatic nerve or part of the sciatic nerve, which subsequently causes pain that starts in the back and goes all the way down to the leg, reaching a specific point depending on which nerve is compressed. So essentially, sciatica means pressure on a nerve, most likely secondary to a disc, that is causing pain down the leg. So most people that have a slip disc experience back pain to begin with. Usually the episode is sudden, and then they find that the pain starts to go down the leg, maybe a day or even a few days later. And in some people, mostly disappears in the back and now settles in the leg. That is a typical presentation of sciatica. And in others, you get pain in a calf, skips the thigh, and then they get it in the buttock. So there is a bit of variation, but classically, most patients present with initial back pain, followed by right or left leg pain, depending which side is compressed. That would be the classical feature. Fortunately, for the most part, sciatica is self-limiting and it will get better. Patients find it really difficult to accept this, in particular when it's at the beginning of the onset of the pain, which is very severe and can reach 8 to 9, even 10 out of 10 on a scale of 0 to 10, 10 being the worst pain possible. So the important thing is to remember that sciatica improves with time in the majority of patients. So 70 to 80% of people have gradual improvement a week, 2, 3 weeks following the onset of the pain. Obviously, they may need help with painkillers or what's known as anti-neuropathic medication. These are specific medications that work on nerves to try and reduce the pain. If these don't work, along with the simple painkillers, then there's a possibility of providing injection as a temporary measure to try and reduce the pain, allow the patient to have physiotherapy, and therefore recover more. In about 20% or less, the pain unfortunately doesn't respond to any of these measures and persists beyond the 6-week period. And they're the ones we generally offer a surgical intervention for. And surgery could be in the form of minimally invasive or keyhole procedure. Nowadays, there's endoscopic surgery, tubular retractor surgery, and traditional open type of surgery. For the most part, the minimally invasive surgery is what I perform for the vast majority of patients. Few may need open surgery, but the vast majority can have minimally invasive surgery without affecting the structure of the spine. Sciatica has various ways of treating it. Sometimes you just simply wait if the symptoms and pain is not severe enough. Physiotherapy, followed by injection. Okay, and this is local anesthetic or sedation, assisted injection around the nerve. And finally, it's surgery in the form of microsurgery. So yes, particularly in the acute phase of the pain, avoiding sitting for any long duration, that usually helps. Sitting in a dining chair rather than a sofa may also be helpful. Keeping active and exercising more is usually counterintuitively is helpful to reduce the pain rather than resting and sitting for hours and not being off work. And work-wise, and people are stuck behind a desk for most of the day, it's helpful to have a standing desk if that alternative is available, so they can alternate from standing to sitting and therefore help themselves. The other thing they can do is basic physiotherapy They can find this on the internet or provided to them by a physiotherapist, which is tilting their pelvis and doing basic physiotherapy maneuvers to try and open the space up for the nerve and help. Any employment or work-related issues by sitting for too long, that can be avoided if at all possible in the beginning, would be helpful for most patients and most sufferers.